It has destroyed a perfectly good human being. It makes me very sad to think of what I used to be to where I am now.
Okay, what's next? Yeah.
The nurse turned another color. She turned white as a ghost and put her hand over her mouth and was like, and I'm laying there like, what's going on?
Experts say this shocking problem happens thousands of times a year and has grave consequences.
Anytime you leave a sponge in the body, it's actually called a retained foreign body. It's very harmful to the patient. It's going to cause infection. Your body's going to start to reject this. And actually you can have very long-term complications that arise from this, including death.
Lenny LeClaire's nightmare began with a routine abdominal surgery in Florida.
Well, that's when the lap sponges were left in, and that's when everything started. I started throwing up and throwing up 24/7.
Erica Parks noticed problems almost immediately after she had a cesarean section at a hospital in Alabama. It was weeks before she learned what was wrong.
For 6 weeks I've been complaining, and you're kind of telling me that it's all in my head, like I had some issues. And finally I get the real diagnosis. The problem is we actually left a surgical sponge in you.
Over about 5 months, I lost 116 pounds. And the doctor who performed the surgery and left the sponges in kept telling me to take milk of magnesia, everything's fine. The sponges had pierced my colon, and all of the toxins, the waste product, was going into my body. I was dying. He said if I had waited 3 more days, I wouldn't be here.
I'm so proud of you. You're doing a good job. Now you have
The sponge initially was down there in my lower abdomen where the C-section cut was, but for those 6 weeks, as I was walking and moving and taking care, providing for my babies, it had slowly moved up and moved all the way up under my lungs, and that's why I had a hard time moving and breathing. My body was slowly poisoning itself, so they said if I didn't have a regular bowel movement on my own, it could possibly set up sepsis poison and possibly, just slowly kill off all of my internal organs.
I've had 6 surgeries and got 2 more to go, and no insurance, can't get insurance. I mean, it's just the whole ball of wax has crushed me.
I'm still not able to have bowel movement. I'm still taking Miralax almost every day. The doctor said, it might not ever go away. It could be for the rest of my life.
I look in the mirror and all I see is just a scarred up mess. That's all I see. When I get in the shower, when I get out, I brush my teeth, it's there. The day that they did that and left the sponges in, when I was wheeled into the operating room, I saw 2 nurses over there counting the trays. I'll never forget that. And then, how could they just leave more than one in? The count was totally off, you would think.
Clinicians at IU Health looked for a technology to track every sponge used in their surgeries.
After we had 13 incidents of retained sponge, now 1 incident is too many. We had found that there is some technology that could help augment our counts to ensure that they were correct. This little green bag contains the RFID tag. Anytime that RFID tag is in the center of the reader, it will alarm.
You know your body better than anyone else. So my advice is to make sure you push through it, make sure you go and get seen by a doctor. And if that doctor doesn't believe you, go to another doctor. And you get it resolved no matter what, because it could be life or death.